Welcome to American University of Armenia's Focus Series, a podcast channel by the AUA's Media Lab. My name is Lusine Musheghyan. I'm a research lecturer at the Turpanjan College of Health Sciences, and my guest today is Dr. Dorian, the Associate Dean of Public Health Practice at the UCLA Fielding School of Public Health and Associate Professor of Community Health Sciences Department. Thank you for being here, Dr. Dorian.
No, I'm excited to be here. Thanks for having me.
It's a pleasure to have you at AUA, and today we will be focusing on well-being and health, more specifically talking about the importance of a holistic approach to health. But before that, I wanted to introduce to our audience. I know that you have held several key positions at UCLA. You have managed the development and implementation of a number of projects with various organizations, including CDC, state and local health departments, community-based organizations, academic institutions, and others. And I also know that you have spent more than 30 years in working in Armenia and Artsakh. You've been closely involved in the development and reorganization of the health sector of Artsakh. And I wanted to ask you about your current project. What are you working on with regards to improving and enhancing Armenia's public health system?
So I always say I sound great on paper. And by saying 30 years, you're also dating me. So knowing where I am. But I'm very excited to be here, as I said. I've been very lucky to be able to be working in Armenia since 1991. A big piece of my work has really been here at AUA, which is also exciting. Today, I was saying as I'm walking around the halls, it just reminds me of my early days of doing my own dissertation, my PhD work. I was at Johns Hopkins and did that work in Artsakh, which, as you said, 30 years ago. And so really thinking about what that's like. I really came back to doing more work in Armenia recently with you and your team, your amazing team, and Dr. Petrosyan as the dean there. Really around COVID, unfortunately, right? So we started doing the National Contact Tracing Program, Contact Tracing and Case Investigation Program. We at UCLA were leading that same type of programming for the state of California and really training and retraining the public health workforce to be able to, sort of put systems together against COVID. And so we were lucky enough to kind of translate some of that program and adapt it here, working with the NCDC as well as the Ministry of Health in that. So during that project, which, it always starts here and then it becomes here, we added so many things as we were working, really thinking around sort of protocols, policies, the emergency operations center, the call center, right? So all of those things. But then it really translated into what can we also do in Artsakh and how does this bridge continuously work? We did the demographic and health survey in Artsakh. We did a 1,000 household survey right between the war and the blockade, which was a very interesting time and collected a lot of really important data. We were hoping the data was going to be actionable data for the Ministry of Health. It turned out to be right now sort of baseline data for a lot of the work that we're doing here today in Armenia. But also now with the forcibly displaced here in Artsakh, as you said, most of my work has been in Artsakh. So really focusing on that. We were able to receive a grant from the Hilton Family Foundation, as well as an incredible donor at UCLA, for us to be able to do the community wellness project in Masis, starting in Masis, but hoping to be able to do it throughout Armenia. That was a long answer.
That sounds exciting and very inspiring. So you mentioned about community wellness project. So how do you define wellness? So what can we presume when we are talking about wellness in general? Maybe the link between health, wellness, or well-being.
So I think it's really important for us to kind of center this whole idea that health is much more than not being sick, right? That's right. The WHO definition. We're in this world, so we know instinctively that's what it is. But a lot of times, especially here in Armenia, when we talk about health, it always goes to a medical system, a clinical system of basically not producing disease. Mm-hmm. But hopefully going to the doctor, hopefully being sick for most of us is a really, really small percentage of our life. But the rest of what we do is well-being. The rest of what we do is health, right? Having a home, having an education, having the ability to make decisions for your family, for your community, feeling empowered to be able to be just happy and have joy in what you do and making those decisions. All of that social links, having friendships, having a social network, all of those things fall into this idea of truly being healthy. So that's what well-being is about, right? It's important to realize, I always say when you come outside, you breathe air all the time. That's well-being, right? You drink water, you eat the food systems, you think about all of these decisions that you love your family. That's all in this concept of well-being. So it's a very holistic approach to really thinking about health, but it's also a holistic approach when we think about just social development and what that looks like, right? And it starts with not having sort of others and the outside sort of tell you how to live. It starts with you being able to, you meaning the individual, the family, the community, really being able to define your context, your environment, and find your place in it. Because that's usually when you feel happy and healthy, is when you feel included in everything, right? That inclusion of yourself.
So the program that we are together running is called the Community Wellbeing Project. It's trying to empower the communities to build resilience and to make the communities be able to take care of themselves on their own without relying always on the outside, let's say, help and support. I also wanted to hear your opinion about well-being in the community context, especially when we also take into consideration the recent happenings of forced displacement and the mass displacement of all Nagorno-Karabakh's population, Artsak's population to Armenia. So what has changed in the community? How well-being and the perception of well-being has maybe changed?
I love your questions, but be ready because I'm going to ask you the same question. So the idea, again, comes back to, I love the word resilience, right? Resilience is that ability to bounce back no matter what, right? That idea that like a tree, you can bend but not break. So how do we actually build that within our communities to have a healthy population, a healthy nation, right? Really thinking about that. So much of this is that community level. When we think about where we find strength from our neighbors. When I always teach, so I do a lot of emergency public health training at UCLA, and I always tell everybody, God forbid, if there's a disaster, it's always your neighbor that has the ability to save you. It's not going to be those fancy search and rescue teams that are going to come and really thinking about that. So that means, again, building that power from inside and building it where the everybody feels that they have the same power. Like there are systems, we need those systems, don't get me wrong. We need the resources. We need to be able to have the materials to be able to do these things. But really we want the thinking and the decision-making and the defining of problems. Like that's a huge thing. A lot of people, so coming back to this forced displacement, from the outside lens come in and say, here are the problems for what people are facing versus everybody defining internally what they're facing, right? And really thinking about that. And then finding the solutions that are real solutions, right? Things that we can actually do. And then building on that. So it's this sort of back and forth in, kind of resinipes, like a rubber band, so that you can go all the way and not break, but be able to sort of think about that. And it comes back to this whole of society approach again. The idea is, can the whole of society really sort of have this flexibility where we all know that we depend on each other? We want rugged individualism, people to be able to, as individuals, do everything and have families stand on their own, but we need each other. So how do we build those systems where we really respect, trust, believe in each other, love one another? I know it sounds very hokey, but really that idea as a system, as a community, so that we can help each other grow. Really thinking about that. Okay, so now back to you. You're part of this project. So what does it mean to you? And sort of when we started thinking about all of this, what light bulbs went off in you or what made you get excited about this?
Yeah, again, first of all, going back to the classical definition of health and sometimes the misconception of people thinking what is health not about, right? So we sometimes think about diseases and the disabilities and the absence of those when we are thinking about health. But most importantly, health is, yes, well-being in terms of social well-being, psychological well-being, of course, physical well-being. So first and foremost, again, for me, the idea of well-being is the ability to be healthy and happy. And this is at the core of our project. And despite the fact that we saw this terrible situation, the following crisis as a result of forced displacement, there are still people with us. Tens of thousands of people are hosted in Armenia, and we are leaving. So we have to do something, right? Again, and if we think from the historical perspective, this is sad, but probably in the future, the humanity in general will still face a lot of other different crises. And if we want to be better prepared and to bounce back, as you said, we really need to build this resilience. And the exciting part about this project is the ability to make some changes at the community level. Those changes are not necessarily about numbers, measurements, and metrics, but the changes in the real lives of real people. So, for example, recently we were doing basic first aid trainings in the community preschool institutions involving some teachers who are educating very little kids in their communities.
The most vulnerable in many ways.
And on one hand, you may think that, well, it's just a first aid training. But on the other hand, you see how empowered these people are from single interaction. Not interacting the project stuff, not that. Simply interacting with each other.
Absolutely.
So our program is serving as a platform to bring people into a safe place where they can talk, where they can encourage each other, where they can support each other, where they can talk about their concerns, about their fears, about their aspirations.
It's a brave space, I always say, more than even a safe space. And I love that because, listen, we were talking about this yesterday. So much about this is about process. It's, yes, we want outcomes, right? The outcome is a resilient community, which is a forever process, right? And a dynamic process. But I agree, so much of the work is the process of doing. It's not about the first aid training. It's about all of the things that went into the context of building and thinking and having them together. And even yesterday, we had people, those that were there, participants saying, oh, I'm coming to another. Is that okay? Of course. The idea was we want you to come all the time and create your own spaces. And again, those brave spaces, as you were saying, and really thinking about what that means from inside out. And you said something else which is very important, and I do want us to reframe it. It's that positive framing, which is so important. It's not looking at lack. It's not just looking at what's missing, right? It's looking at what do we have and how do we build upon that? Because we have incredible people, incredible humans here at the moment, living right now. So how do we build that? But also think about them raising future generations that will be stewards of our country's future. So really thinking about all of that.
Yeah,
that's exciting.
Yes, it is.
And hard.
Yes. In your speech, you also mentioned about the importance of systems. Again, of course, we do realize how various systems and infrastructures have vital importance in supporting resilience. I also wanted to ask about what is the role of these various systems in designing public health interventions, and not only public health interventions targeting well-being in general, taking into consideration these diverse perspectives and experiences of really very different groups of populations living in the communities.
Yeah, that's an interesting question because when we also think about programming in general, we always think about programming systems, right? Because that's the only way things can be sustainable. The idea is, just like I tell my students, when we do public health, as public health practitioners in a community, we're just a tool. The community is the expert. We're just a tool who knows a little bit more of public health science that can help in moving these things forward, right? And so really thinking about that. And that's the same for government systems, right? The idea is the systems should be empowering. Yeah, the systems need to create some guardrails for safety and health and sort of thinking about that. But the system itself should not be an impediment, a hurdle to moving forward and thinking about that. And systems change. That's the point of advocacy, right? Really thinking about, even when we think about health policy, it's through doing these things that we realize the system isn't working. But there's also a really important part of public health in general. And we never really defined public health, which is also an interesting thing in Armenia when we think about it, because I don't know how much people really understand what that platform means when we talk about it. But let's think about this holistic health, that really when we are doing this work, it comes back down to, again, creating structures that allow for individuals to make choices that matter for them. Not the choice we want them to make, but the choices that they need to make, right? Equity in choice. Everybody needs to make different choices. They have different realities. As much as or we think that in Armenia, everyone is Armenian and it's that homogeneity is not true, right? And that's important because sometimes we come to the table thinking we know exactly what the person in front of us must be thinking because, it's an Armenian family, XYZ, right? Which is so not true. So really in honoring that diversity and coming back to the table and really thinking about allowing people to make those decisions that make the most sense, again, for them, which then builds systems. Systems are for the masses, right? So we want to make sure that the system doesn't hinder kind of that bell-shaped curve, everybody, when we're catering to the center, right? And thinking about that, differentiating the systems as needed. But again, sorry, I missed this one thing I wanted to say, which is in public health, what's really important is linkages. One of the things that we do and is part of sort of our MO of operation is how to link people, link resources, link systems, link communities, link, global partners, because we don't reinvent the wheel and there's a power in doing things together. So our program is also about that. We don't want to reinvent the wheel. And so much is happening in Armenia. So how do we link people to sources, to programs, to each other to really empower in what they're doing?
Exactly. Not just creating another parallel system, which is even in the classical literature something that we should avoid always, right? Instead, empowering, strengthening, enhancing the existing systems, but also making these connections between them. Making connections is in itself already another good service, and for which, on one hand, you probably do not need many resources, but at the same time, it's really consuming a lot of effort.
But it also comes down to trust, right? So when you're linking individuals, they have to trust you that you're linking them, right? And so thinking about that. So again, comes back to process. It's all about if the community links each other, they trust each other, they know each other, right? It's not an outside group doing this work. So really, again, it comes back to empowering them to understand. We also teach One Health, because it's more than also just humans. It's your environment. It's, sort of the agriculture we have, the food systems we have. So thinking about all of that and linking, the power rests in the community.
Thank you. If we try to summarize our discussion, I wanted to ask another question, considering your extensive experience and expertise in this field. So what would be your advice to different organizations, different grassroots initiatives, which try to make some positive changes in the lives of communities? Just share some piece of advice.
Wow, that's hard. Because I'm also always learning, but more importantly, and just to be super real, we all make mistakes, even though we know what we should be doing, right? And sometimes it's because it's hard to do what's actually real, and it's a long process. People want to see instant outcomes. It doesn't work like that, right? So, and by the way, this is a forever process. It's that idea of improving generations forever to feel empowered, and it changes. What we did pre-COVID doesn't always work now post-COVID, right? Just thinking about environments and how that changes. But again, I think the most important piece is this idea of humility. which sometimes is hard for us as a people. Armenians aren't very good at being humble in general, but it's a really important piece when it comes to doing this work. Because again, I only know public health science. I am not an expert of MOSIS. I don't know what's happening there as we're working, etc. But I come in as one sort of layer in helping and thinking about this and remembering that, keeping my ego in check and saying, okay, what do we need to do and how can we together try to make and work this process without me realizing I'm also not an equal. You know, sometimes we'll say, oh, I come in as an equal. I'm not even that. I shouldn't be that because I will walk away from this community, unfortunately, at some point, right? So the idea is, how do we really do this work in making it sustainable? And sustainable means the community has to do the work. It's theirs, right? We're again in sort of thinking about all of this. And that's a lot harder than it sounds because, again, it's about process. It's about trust. It's about building. It's about not letting perfection get in the way of good. That's another problem we have. We like everything to be perfect, and unfortunately, then we don't do the good, right? That doesn't mean settle for the good. It means shoot for the perfection. But sort of all of these things, and it's a lifelong process. It's also a lifestyle, right? So it's also a leadership style. So if we want to empower communities, our systems have to allow the empowerment of communities. A lot of times, those authentic voices become scary voices for leadership. And I know that, right? But those are the voices that matter. They are the people. So I think thinking about how to turn these things on their head while you're doing all of this is important to keep in mind as we move forward. And then one last thing I would say is, as a country, there are priorities that we've created. And we need to really work towards those sort of overarching priorities, all of us. We shouldn't be able to just come in and decide my priority is X, right? But that's not Hayastan's priority. So really understanding how to make sure that you're programming, because if it's authentic and really what you're doing, truthful to what you want to do, it will fit into those priorities. Creating a healthy nation and you fit into what that means really matters. And as you said, we don't have all the resources. We're also, every Armenian organization, at least working here, I'm not talking even outside, even multi-agencies, we're all competing for resources. So unfortunately, we don't want that competition to be at the expense of the health of the population. We want that competition to be about doing the best program towards that priority. We're to priority with each other, right?
Thank you. Thank you, Dr. Dorian, for being with us, for taking your time and talking with us about
talking
well-being.
A lot.
No, not really. It was very interesting. So thanks again for your time, for your enthusiasm, for your power, for your encouragement, and just for you as a human being, and so motivating for all of us and serving as a good example how to do real public health practice in facing all the realities that we have.
John, thank you so much.
And thank you for joining us. We were discussing the importance of well-being and health, especially in the context of building resilience in our communities. So thank you.